Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Ryan back here with us today for his second left shoulder rotator cuff posterior surgical rehab session that we're doing a case study on, utilizing the rapid release technology on. So this is number 2. Let's take a look. Okay, let's have you click forward and backwards. Notice he's not wearing his sling today, which is an improvement. I'll let him tell you how it's done since yesterday.
It feels a lot better since yesterday, for sure.
All right, good. So let's go ahead and decompress you first. Anytime you have an injury or a surgical intervention, you are going to develop fibrotic adhesions and scar tissue surrounding the area of injury or incisions. And if you do not keep that area moving or remodel the soft tissue, collagen fibers and fibrinogen being laid down, it will develop into adverse scar tissue formation. That scar tissue is permanently weaker, less elastic, meaning doesn't move in a normal range of motion, more sensitive than normal uninjured tissue because it has more neurofibrils going to it, and it also is, there we go, good, weaker than normal uninjured tissue. So the goal behind any post-injury or post-surgical event is to get the patient moving passively first, and then left side of your neck, fine. Passively first, and then more into active. But right now he's real early on. Yesterday was his first treatment. Today is only his second. Okay, so let's come over here on your tummy now. There we go. And this applies to whiplash, spinal trauma, soft tissue injury in any joint or in any part of your body, not just to post-surgical incisions and lesions. A lot of you women can identify with, if you've ever had a total hysterectomy, the amount of fibrotic adhesions and scar tissue that develops in the abdomen following hysterectomies. And anybody that's ever had knee surgery or shoulder surgery knows that prolonged immobilization in a sling or a cast of any kind, once you get that cast or sling off, just like you notice Ryan's holding his arm like this because he's been in a sling for 2 weeks, the tissues will actually heal up in that configuration, and then if you wait too long to start rehabbing it, it's very painful and difficult to rehab that area. There we go. Good. So we're gonna start him off with some turbinator in his lumbar spine and paraspinal muscles. mobility and getting adjusted for the last 2 weeks. The old medical model used to be one of immobilization. So whenever somebody got in a whiplash injury, for instance, you would see them wearing a neck brace. Or when you had back surgery, you would see them immobilized in bed for a while. The newest scientific research and medical model for post-surgical rehab is to get that person moving as quickly as possible so that the joints can be restored to normal function. That includes muscles and ligaments. Muscles move the bones, ligaments hold the bones together. Now we're doing the high frequency vibration, which will resonate down deep into the tissues and reduce the adverse fibrotic scar tissue formations that are occurring during this healing process. But he's in the healing phase of his injury and post-surgical right now. And that's where fibrinogen is being laid down, forming new tissue. Neither the collagen fibers are going to line up along the lines of tension and stress in a full range of motion, or if immobilized, unfortunately, in that configuration. So that's why it's really important to get started on your rehab following surgery or an injury right away. Good boy. Now you notice I'm using the kind of the knob end of the Rapid Release Pro 2 now, which is a little more targeted focus. Okay. So Ryan, let's have you sit up today and remove your shirt for us, if you would. Face towards Renee. As you can tell, it's kind of difficult for him to get his shirt on and off because of the left shoulder pain. And there's still pain in there. It's not completely gone at this point in time, but actually it's a lot better than it was first day, huh?
Yes,
So we're going to start off with his trapezius muscle and the left side of his cervical paraspinal muscles. Now I'm not putting any pressure, downward pressure on this because the deep vibration resonance works from just having it lightly placed upon the surface of the skin. Got the motion on there this morning. There's some oil on it. Better. Then we're going to work back here in the posterior deltoid. Now this goes deep down into the tissues. So it's not just superficial vibration on the skin, it actually gets down deep into the deeper muscles and the ligaments that are surrounding the whole shoulder, which are many. And I'm going to get down into his triceps muscle here. Lateral tricep. And now his lateral deltoid. And you can see the incision right there. Not a very big one. It's what they call microsurgery. But there's really no such thing as a minor surgery. And we only refer patients out for surgery when it's absolutely necessary. In Ryan's case, it was. If we can't help someone with the type of, now we're on his anterior deltoid, if we can't help someone with chiropractic care and adjustments of the affected joints, then we will refer them out for the appropriate surgical procedure intervention or more invasive treatment if necessary. And we worked on your shoulder for what, for about a month? And had some MRIs done and decided at that point that the only really recourse for him to get this thing corrected was to get it reattached, because he had a grade 2 tear in his rotator cuff. Actually, it's totally torn, wasn't it? So it was totally torn. That's grade 3. That's a complete separation of the ligament. Now we're right over the incision. There's a lot of scar tissue right there, so we're going to work over that area. And the anterior deltoid again. Work it into the pec even, below the clavicle. You don't want to do this if someone has a pacemaker, but if you can tell, Ryan's a lot more in shape than that. He didn't have a pacemaker. Is that a little tender deep down in there? I'm doing this?
Probably, yes, sir.
But not only does this help resolve adverse fibrotic adhesion development, but it actually resonates and improves neurological function as well. So I'm going to use a more targeted surface on the Pro2 to work on his trap. And we're going to get back here onto his teres major and teres minor, which is right on his scapula. There's probably some sore ones right there too. Right there especially. And the posterior delt. Following it all the way around to the lateral deltoid here. And then straight up through the belly of the lateral deltoid. And then the origin of the lateral deltoid, and this is right over the incision itself. The acromioclavicular joint is right here. That's where the clavicle meets the acromion process. So that's the AC joint or acromioclavicular joint. And that's where you had the spur clipped off right there, wasn't it?
Yes, sir.
He also had a osteoarthritic spur that had developed on his acromioclavicular joint there, creating an impingement syndrome as well. And that is synonymous with osteoarthritis. And you can tell that Ryan's been working out for quite some time, heavy weightlifting and martial arts, so he has taken a lot of abuse to his joints in his shoulders and spine and knees. And we're adjusting all of those things. We love treating athletes because athletes always desire to get back in the game as quickly as possible, and that's what we're doing here with Ryan. We're going to get him back into being Ryan again rather than wearing that sling for 6 weeks. Now, whenever his arm begins to get, or shoulder begins to start aching or hurting from not wearing the sling, you know, he puts it back on for a little while and rest it, which is exactly what he should be doing. But we want to keep it as mobile as possible to remodel this scar tissue. Now I'm going to move his elbow and his shoulder passively here slowly. Just let your elbow go. There you go. We're going to get full extension out of that elbow today, right there. That's full extension. But that's the first time it's extended that much.
That's good.
Davis's law states that tissue will remodel along the lines of tension and stress being put on it. So we want him to have a complete full range of motion, not only in his shoulder, but his elbow here too, from wearing that support sling. So we're going to work on his forearm muscles right here as well. You'll be able to see the little hairs on his arm waving with the high-speed vibration. We'll do a little more targeting. Probably a little tender right through there, huh?
That's
Break
pretty
the
good.
rail. What's that?
That's pretty good.
Feels good, huh? Yep. A lot of people who get elbow problems such as tendonitis or golfer's elbow or tennis elbow would benefit from this as well. Now we're going to bring his shoulder more into abduction. I don't want to drop his arm and hurt his shoulder, so we're gonna continue to abduct his left shoulder a little bit higher as we go along through these sessions. This is only a second one, so I'm going to do it slowly. You don't want to do this too quickly or you can re-injure the area, so we're going to take things slow and do them in order. But by doing this early on like he is, we're going to be able to help restore him back to normal, full function of his left shoulder. The weightlifting for me just to lift his arm up like this. That's the most you've moved your shoulder up high right there in there.
That feels good.
And then we let it down slowly and we just keep doing this while it's on there and the patient's completely relaxed. This is all passive at this point. In a week or so, we'll have him doing some more active movement with his muscles so that we can start initiating the active phase of this part of the rehab. And for pain control also, we've got him a TENS unit, which is a trans-electrical nerve stimulation unit that he can put on there in the daytime or at night, and it will send electrical impulses into the muscles, helping those muscles to increase their circulation and heal quicker too. We use preferred positions out of Tampa, Florida for our TENS units. I'm going to let this down slowly. That's adduction. I'm just going to let this kind of rest right over his incision right now to break down this scar tissue right over the AC joint and superior middle deltoid. Very good. All right. Ryan, would you mind sharing with our YouTube subscribers? You just had this done for the first time yesterday, and how did it feel for you right afterwards and throughout the day yesterday?
It felt really good, especially with the arm movement and whatnot.
Better than it has since you had the surgery?
Absolutely.
Great. So this is his second session utilizing the rapid release technology. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.